We can always edit it, it's okay. You guys ready? Okay. 3, 2, 1, action. Hey guys, how's it going? This is Ulysses with Amici Hospice. I'm one of the directors for Amici. I just want to go ahead and do a quick in-service on the EOBs, the explanation of benefits. This is paperwork that needs to be signed prior to starting the service. These are all the consents that we need in order for us to actually work on the patient, as well as, provide any service medication. It gives us permission to go ahead and, provide medical assistance on the patient's behalf, right? So with that being said, let me explain these. First and foremost, before we actually get to the explanation of benefits, we need to make sure that the patient is eligible for hospice. This is done by running all of their insurance credentials, guys. In order to run eligibility, we need driver's license, we need Medicare card or Medi-Cal card, as well as any personal insurance cards or private insurance cards, whether it's Blue Shield, Blue Cross, Molina, HealthNet, whatever it is. Upon asking for these things, ask for as much information as we can. If for some reason the patient does not have these credentials, we also have another option, guys. We can ask for their first and last name, date of birth, as well as Social Security. The office will go ahead and run eligibility to make sure they are eligible, and based on the eligibility, we can decide whether we decide to take the case or we're going to have to, unfortunately, give up the case, or it just depends on the status of eligibility. So once eligibility is established, we're going to go ahead and present the EOB forms, the explanation of benefits. We have a pack that's about 8 pages long, guys. It's very easy. It requires signatures. The key here is to be able to explain basically what each paper means and what they're signing. A lot of people feel like, they're signing their life away. A lot of people are very hesitant about signing. So kind of practice on your presentation. Everybody's presentation is going to be different because everybody's personality is different. Patients are different. We have different cultures, right? So with that being said, just find a way to explain it so you can get comfortable. We have 2 different ways of doing the EOBs. We can either do it on paper, which is a wet signature, or we can have them signed through DocuSign, which is also a very easy process. For DocuSign, the office would get basic information, including email, so we can send them through DocuSign, and the patient, family member, or POA can go ahead and sign via telephone or tablet or computer, whatever it is, okay? If we're doing a wet signature, either way, we get all of these signed, we make sure we date everything, we make sure every last piece of information is filled in, guys. It is very important. We need signatures, we need initials, we also need, if there's a POA, we need POA information on there, okay? Okay, so let's start with page 1. Page 1 is the hospice election statement. What does this mean? It just means that the patient or family member or POA has chosen our hospice willingly. Nobody has forced them. Nobody has made them choose this. The free will allowed them to look at other companies and choose us. So this is a hospice election statement to where they clarify and give consent stating that they did choose our hospice. Okay? We do need some initials and some dates on there. We also have 2 boxes that need to be checked. The first one is, I do not wish to choose an attending physician, which means we could still go through their primary care physician and work along with their primary care physician for their hospice treatment. But the most common one is the second box, which is, I authorize the Amici hospice physician or medical director as my attending physician. This allows our medical director to go ahead and give orders, provide medications, increase frequencies, increase medications, for the patient. This is probably the easiest and most common one, okay? We do have a physician's full name on there. Eventually, you'll start learning our medical director's name, their MPI number. All of this stuff needs to be filled in. There's also a blank space for start care date. Let's put the same date that that we started on. Signatures, you also need a witness signature, would be us. We would be the witness to this, so we sign as well and date it, right? Okay, so that is the hospice election form. That's Form 1. Form 2 is the informed consent and treatment authorization. Once again, page 1 was just to consent that they chose us as a hospice. Page 2 is basically that they are consenting to treatment and authorizing the treatment of our service. Same thing. Allow the patient and the family member to go ahead and read these and just, kind of breeze through it. If they have any questions, they can always ask us or call the office. But for the most part, everything is very self-explanatory. It's definitely on there. So page 1, elect our hospice. Page 2 is the informed consent for treatment, which allows us to go ahead and provide treatment. Page 3, patient's bill of rights. This is a list of all the patient's rights that they have when they join our service. There is about 31 rights. We won't go through all of them, but please encourage the patient and the family member to breeze through it. And the family will get copies of all of these consents. There is a yellow carbon copy that will stay at the binder after we finish all of our signatures. Okay? So patient's bill of rights is really important, so the patient knows exactly what their rights are when they are on our service. Page 4 is patient's responsibilities. Being on our service, the patient has certain responsibilities that are needed in order for us to provide this quality service. For instance, it would be notify us of change of address. Notify us if the primary care physician changed medications. Other responsibilities are treating our staff with respect. There's a couple of patient responsibilities on here. They're very easy and pretty much, common sense, basically. You want to make sure that the patient respects you as well as us respecting the patient, and certain things that we need to know. Page 5, HIPAA and Privacy Act and practices. The HIPAA and Privacy Act paperwork just states that we don't give your information or the patient's information to anyone who's not authorized to have it. Okay? We don't sell information to clinics. We don't sell information to anyone that's not involved in the care. The HIPAA notice of privacy practice just means that the patient is allowing us permission to request H&P from some of the hospitals they've attended to, or clinics, or if there's a podiatry consult, they give us permission to go ahead and provide the podiatrist information or insurance information on the patient's behalf. These are all HIPAA practices, and we need this form signed, guys, and initialed. Consent to a photograph. This is where you explain to the patient that on certain occasions you will have to take pictures if there's a rash, a cut, swelling, redness. These are all things that we want to have on file. So the patient is going to give us permission to go ahead and take these pictures and put them on file, send them to the doctor, send them to wound care, and this is all very necessary to provide good quality care for the patient. Number 7, informed consent for a telehealth visit. As you know, our medical director cannot be everywhere at one time, so what we do is we use telehealth, guys, and we're always able to go ahead and connect to the doctor at bedside, whether it's a new order, whether it's to present symptoms to the doctor, or for admission. We need this telehealth consent to go ahead and give us permission to go ahead and call the doctor via Zoom, via Meet, FaceTime, whatever it is that you use, WhatsApp, for communication. I think we've already went through this one. I did. Informed consent and treatment. Informed consent and treatment authorization. This page here is really important because it asks you about advanced directives. It asks you about power of attorney. If we receive these copies, look at all of the options on there. Basically, you do want to let the patient know that there's 3 choices, guys, as far as advanced directives. Now, The first choice is, they're not choices, they have to be checked off. I apologize. So you want to inform the patient that if they have advanced directives, we will respect them and they will be put into play. Okay? We do need a copy of these. So if you have advanced directives, make sure they give you a PDF copy, or we could scan them at bedside. The second one is, if you don't have advanced directives and you would like to get them, as long as you don't have dementia or Alzheimer's, we can go ahead and have our social worker come out and help you with these advanced directives. There will also be a notary public that would be needed, and we have mobile notary publics that can actually go to the patient's home and help you with these things. Our second option would be, I don't have advanced directives, but I would like information on getting them. This is where our social worker steps in, like I just mentioned, and helps you with that. The third one is, I don't want advanced directives. I don't have advanced directives, and I don't want advanced directives. But that does not stop the care. And that is okay. The patient does not need advanced directives to continue with hospice. But we do need to make sure that we explain these things during admission to let them know that they do have an option to get advanced directives. And if they want it, we can help them. If they have them, then we respect them. If they don't have them and don't want them, then it's okay. It doesn't hinder their care. We'll continue to care for them here at Amici Hospice. Okay? If they do have them, we expect them to give us a copy. This is where you will mark on there, copy received or no copy received. If you do get advanced directives and there is a POA, on the right-hand side, there is an area to where you can put the POA's information. This is very important because we do need this information. We need name, address, and phone number of the power of attorney, as well as the paperwork. Towards the bottom, there's a couple of receipts of information, which means that they got a copy of everything they signed. From, the patient's rights, the HIPAA, informed consent, the hospice selection statement, the Privacy Act, advanced directives, financial agreement, all of these things. So you want to check all the boxes on the bottom just to make sure that they did receive a copy of everything, guys. Last but not least, we do need signatures and initials, which are very important and complete the whole process of the explanation of benefits. I hope I was fairly clear on that. Besides our 8-page packet for EOBs, we also have a POST, guys. The POST is a physician's order for life-sustaining treatment. This is very important. In hospice, we're always pushing for DNR. This is the whole reason they're on hospice, because they've tried every other treatment possible to make sure that they're able to heal and get better. Unfortunately, sometimes that is not an option. So we have to find a way to explain the POST to make sure the patient understands, to make sure they're 100% on their decision. We do have two options, guys. We do have DNR, which is do not resuscitate. This means if we find a patient without a pulse, without a respiration, no vital signs, that means they've expired and we let them rest in peace. No resuscitation, DNR, do not resuscitate. This is the most common one in hospice. And this is what we're always pushing for, guys. If a patient tells you they want full treatment, they do have that right, but it almost doesn't make sense because there's a reason they're on hospice. It is not to, it is to keep the patient symptom-free and comfort measures and make sure they're okay. And it usually doesn't include prolonging their life. It just means we want to make sure whatever life they do have, they are comfortable, during that time. If a patient does have, decides on full treatment, then it's okay, we can respect it. Let's go ahead and provide the full treatment, mark it on there, and as the care goes on, we can go ahead and talk to the patient. Sometimes the patients are scared, they're uninformed, and I get it. Nobody wants to pass, which is understandable, but they do have to understand that sometimes resuscitation can make things worse. For instance, dementia, Alzheimer's, it is an ongoing disease progression that doesn't stop, it doesn't pause. It might slow down a little bit, but there is no time frame, and unfortunately, it just moves forward. So even if we were to resuscitate a patient with Alzheimer's, it's really It's really hard for the patient to come back, and it's only going to get worse, guys. It's not going to get any better due to the fact that Alzheimer's and dementia just moves forward, you know? Not to mention the fact that organs are already damaged, like the brain, possibly heart, possibly, you know, kidneys, just depends on the diagnosis. So when a patient passes, we don't know how long they've been without oxygen. The organs have been without oxygen. So if the organ's already damaged and then the patient passes and there's a lack of oxygen there, that means they're furthering damaging the organs. Which means if we bring them back, there's a very good chance, a very high chance that the patient might be in a vegetable state, or, you know, not in the state they were in before, unfortunately. Right? And we need to make the patient understand these kind of things. With that being said, we do need signatures. We do need the patient to go ahead and make these decisions. If the patient is unavailable to make these decisions, this is where we get the family or the power of attorney involved. And signature, we have the doctor sign it as well, just to make it legit and effective. And, you know, we respect their wishes, guys. This EOB and pulse is all done initially at the beginning of the admission. Like I said, it is eligibility first. Once they are eligible and the family chooses hospice and Amici Hospice, then we dive into the EOBs. Thank you very much. My name is Ulysses, and I hope this was very clear to you folks. Just give us a call at the office if you have any questions or concerns. Appreciate your time. Thank you very much.